We are taught from a very young age to fear fatty foods. The standard warning is simple: eat too much fat, clog your arteries, and eventually your heart stutters and tightens. But if we look closely at clinical data, a medical paradox emerges. Patients who are diagnosed with diabetes almost universally suffer from dangerously high cholesterol levels. What makes this strange is how these patients eat. Many follow strict, low-fat diets prescribed by their doctors, yet their cholesterol numbers remain stubbornly high. Because removing fat from the diet fails to lower these numbers, we have to look for a systemic glitch hiding deeper inside the body. Cholesterol is a vital biological building block. Your body needs it to construct the protective walls around every cell, to synthesize vitamin D3 for bones, and produce essential sex hormones like testosterone and estrogen. Because this resource is absolutely critical for our survival, human biology does not leave its supply up to the unpredictable nature of our daily diet. This split-scale diagram shows exactly where our cholesterol originates. Notice that only 30% of the cholesterol in your blood comes from the food you eat. The other 70% is manufactured entirely inside your own liver. Since the liver controls the vast majority of our cholesterol supply, a dangerous spike in the bloodstream indicates an internal manufacturing error. That manufacturing error is driven by a condition known as insulin resistance. When we consume a diet heavy in carbohydrates, our blood sugar spikes. To manage this, the body pumps out massive amounts of insulin. Over time, the body is overwhelmed by this flood and becomes resistant to it. This animated model shows how that excess insulin creates the first pathway of the glitch. The surplus insulin molecules travel to the liver and hit a master on switch. This rogue signal forces the liver's internal factory into overdrive, rapidly pumping out a massive surplus of cholesterol. Now watch the surrounding tissue. Insulin resistance creates a second pathway by acting as a barrier. The receptors on your cells physically block the absorption of these newly minted cholesterol particles. You now have a system that is simultaneously overproducing material and refusing to utilize it, causing cholesterol to pile up in the bloodstream. In this high-sugar environment, the excess glucose bonds with the unused cholesterol particles. This process makes the cholesterol sticky and adhesive, causing it to snag on the artery walls. These bonded particles clump together, gradually forming the blockages that restrict blood flow. High cholesterol is the mechanical consequence of a broken blood sugar regulation system. When patients present with these high cholesterol numbers, the conventional medical response is to prescribe a class of daily medications known as statins. This geometric model shows exactly how those drugs operate. The statin travels directly to the liver and forcefully jams the gears of the cholesterol production line, shutting down the internal factory entirely. While the production stops, the underlying insulin resistance remains. The cells are still blocked from absorbing whatever cholesterol is left. Because millions of cells die and are reborn every day, depriving them of the cholesterol they need to rebuild their walls leads to chronic muscle pain, severe liver strain, and even worsening blood sugar levels. Treating a high cholesterol reading with statins is a localized band-aid. It starves the body's natural repair mechanisms, while leaving the systemic metabolic crisis unaddressed. Taking a pill to force cholesterol down is like clipping away at the leaves of a tree, entirely ignoring the rotting roots underground. To heal the roots, we must look at the diet's glycemic load, a measure of how quickly food turns into sugar in our blood. Lowering our intake of carbohydrates directly reduces those massive blood sugar spikes, which in turn drops our insulin levels. Consider two different snacks. A standard low-fat Marie biscuit contains virtually no fat, but its high carbohydrate content creates a severe glycemic load, triggering heavy insulin spikes. Compare that to roasted peanuts. They are rich in fats and protein, but their very low carbohydrate content keeps insulin perfectly stable. When you make dietary choices that keep insulin low, a biological chain reaction occurs. The liver's overdrive switch turns off, normalizing production. Without the barrier of insulin resistance, your cells regain their natural ability to pull cholesterol out of the bloodstream and use it for daily repairs. As the internal glitch resolves, the surrounding metabolic markers improve. High blood pressure begins to normalize, and excess body weight drops away, and the body regains its energy. Masking a symptom with a pill fails to solve the underlying imbalance. True stability comes from managing the diet's glycemic load, allowing the body to restore its own natural regulation of both insulin and cholesterol.